Hey, this is Dr. Justin here. Today's talk is going to be on allergies. It's the springtime. Everyone's dealing with them. I hear it from all my patients. They got the runny eyes, a little bit of mucusy nose. They're just not feeling well, a little bit of skin irritation, puffy eyes. And again, the question is, how can we fix it? How can we resolve it? All right. So again, allergies. What is it? So essentially, the kind of springtime allergies that we're seeing is usually some kind of environmental particulate, whether it's dander, different pollens in the air, etc. So again, the conventional approach, I'm going to just kind of paradigm it for you so you can see what the conventional approach is and what the natural functional medicine approach is. So the conventional approach, what we tend to see is mainly 4 drugs involved. We tend to see Allegra, Zyrtec, Claritin, and Singulair. Those are the big ones that we tend to see with these environmental allergens. And the kind of overall goal is to give something that's usually suppressing an immune response. Right? It's not addressing, it's not thinking from a causal level, what is the underlying cause? Why is the immune system hyper-responding? No, it's just saying, how can we suppress it? So from a acute, short-term perspective, I guess that makes sense, but when you have people dealing with these allergies their whole life, I think it'd be better to have a healthy functioning immune system and address the underlying cause. Okay, so the natural or the functional medicine approach to addressing allergies is pretty simple. One, we know allergies are essentially caused by systemic inflammation. So anything that makes the body more inflamed is going to increase the chance of an immune system that hyper-responds, that thinks things that maybe like pollen and dander are dangerous. They think it maybe is like a virus or a bacteria, and it's really not. So we essentially want to do things dietarily and lifestyle-wise and supplementary to help make the immune system more intelligent, so it's not trying to mount an attack on things that are essentially harmless. Okay, so again, underlying cause. What is the underlying cause of allergens? Well, one, there's different kinds of allergens. So we're not really talking about anaphylactic kind of things like a peanut butter allergy or maybe an allergy to strawberries where you have to have an EpiPen because your throat closes up. So I'm not really referring to these here. Those are more genetically inborn allergies. Talking to things that are more environmental that you tend to see around this time of year. So again, what's the underlying cause? There's a couple different things. It's never a one-hit wonder. So usually a handful of things work together at the right time tend to produce the best effect. So because of my background in holistic medicine, I always like to look at food first. So a great approach to just lowering systemic inflammation and lowering food allergens is some kind of a paleo approach or a paleo diet. So cutting out grains and dairy and legumes are very, very important to decreasing systemic inflammation. And then adding healthy saturated fat like grass-fed beef, coconut oil, cold-pressed olive oil, ghee, butter fat, bacon fat, all that is super good, very anti-inflammatory, and does not push the body into a state of inflammation, like you may see with the vegetable oils and with excess sugar and grains and refined carbs. So again, getting the right balance of fats and proteins in, and it's a little different for everyone. So if you have any questions, feel free and email me or leave me a post on the video. So next, we already kind of dealt with the dietary stuff, the general picture on this. The gut's super important too. So if we see people with parasitic infections or fungal overgrowths or bacterial stuff going on, addressing that helps the whole immune system, because we know about 70 to 80% of all our immune cells are in the gut. So if we have gut stuff going on, the diet will help, but sometimes we need to actually go after it and address the underlying infection. Okay, third, eating high-quality food. So we already talked about what food to eat, but now making sure it's hormone-free, antibiotic-free, not loaded with pesticides and chemicals, because those are all going to increase inflammation. And GMOs are included, so avoid all those GMOs. Next is going to be water. So one of my mentors always said, water is so important. Why? The solution to pollution is dilution. So the more we put high-quality water into the body, the more we add extra fluid in the lymph, which allows more toxins to be taken out, and it allows our liver and kidneys and detox pathways to work better. And excellent, one of the last things that we do here is a few different supplements that we figure out on an individual basis that tend to be very, very helpful in making a balanced immune response. And these are usually recommended on an individual basis, but just a general recommendation is we see things like vitamin D are really, really important to having a balanced immune response. So making sure your vitamin D levels are optimized. 2 is a couple of herbs we get great results with, like stinging nettle, quercetin. These are excellent herbs. Propolis, bee pollen, that help balance out that immune response. N-acetylcysteine and amino acid is very good as well. And if we usually combine the right combination of those and we individualize it based on the patient's needs, we see a significant reduction in allergens. It may not be a home run for everyone, but everyone at the very least will benefit, and the majority will actually have no more allergens. So I hope I gave you guys something to think about. Any questions, feel free to write it in the post or shoot me an email. The site is justinhealth.com, and if I can help you out, please let me know. Hope you enjoyed this post.